Coach ready? Good afternoon, everybody. Welcome to the City of Toronto's daily COVID-19 media briefing for March 26, 2020. A friendly reminder to journalists joining us today online, please turn off mute on your computers. We'll unmute you on this end when your turn comes up to ask a question. We're joined today by Mayor John Tory. Welcome back, Mr. Mayor. Dr. Eileen De Villa, Toronto's Medical Officer of Health, and Toronto Fire Chief and General Manager of the City's Office of Emergency Management, Matthew Pegg. Mayor Tory.
Thank you, Brad, and good afternoon, ladies and gentlemen. I'm glad to be here in person again to provide this update on the city's ongoing response to COVID-19 with Dr. De Villa and with Chief Pegg. Every morning at 7 o'clock in the morning, I have, throughout the period of this crisis, joined in a call with the two of them and many representatives from divisions right across the city, where we get an update on all of this work the city is doing to deal with this pandemic. This morning meeting helps us to know what is working well, what things we need to work on that day and in future days, and make sure that our response is coordinated right across the city in all respects and coordinated as between the different governments. I think it is important that people should know that we are doing exactly what they would expect their city government to do, working together to confront this pandemic as best we can while keeping essential and critical services that people rely on, keeping those services going. I want to thank all the city workers who are continuing to do their jobs during this very trying time, and all the people who don't work for the city, all the other workers of all kinds who are in many cases essential to the well-being of the city and to the well-being of its residents. And I want to thank the residents themselves for their patience and for their understanding and for their ongoing support, because I know it means a lot, not just in the context of our war against this virus, but it also means a lot to our staff to have the cooperation and understanding of our residents. That's what we do here in Toronto. We stick together in tough times, we take care of each other, and I'd like to hope that we all follow the advice of our Medical Officer of Health. There's no doubt that sadly there will be tough times ahead financially for many people across our city, and so I wanted to talk about two things today. First, as part of the ongoing work of the Mayor's Economic Support and Recovery Task Force, we are sending surveys to businesses across the city so that we can hear directly from them as soon as possible about how the pandemic is impacting them and what information and support would be most helpful to them at this time. We've had some consultations with them already, but we're now going to try and spread that out to a much larger number of businesses to make sure the things that we are doing and the things that we're advocating to the other governments to do are achieving the desired result and helping in the way that they think is best for them. The survey will be available at toronto.ca/COVID-19, and it will help us as we try to put plans in place to rebuild our economy after this incredible disruption. We'll be looking to receive the input as quickly as possible, days, not weeks, so we can act on it and advocate on it. And so I would urge people to go and have a look and fill it out and participate in it so that we have that information. I want to make sure the city is doing everything it can and advocating to the other governments to do everything they can to make sure that businesses, which after all employ thousands and thousands of Torontonians, can be back in business as soon as possible. That is also why we announced last week that we would have a 60-day grace period for City of Toronto tax, water, and waste utility payments for businesses and residents. This ensures that for individuals and businesses who can't pay due to a change in their circumstances, that they have some time to get their finances in order. It leaves that money in their accounts, the small businesses and the residents, while we all regroup, and that includes government. To those who are fortunate enough that they can still pay, I encourage them, please pay on time if you can. The city obviously has a continuing need to finance the services that we continue to provide to the residents of the City of Toronto, and so it will help us a great deal if people who have not had a change in circumstances and can still pay, do pay based on the prescribed schedule. Second, as we get closer to the end of the month, I want to repeat my message that I've been trying to repeat as often as possible to private landlords to do the right thing for those who need help or need at least some reassurance and some help right now. On Monday, I had a call with many of the major private residential landlords and surveyed how landlords planned to help tenants who may have lost their job or lost their income due to the recent turmoil, and at the same time have rent payments that are due soon, perhaps April the 1st in many cases. Many of those companies pledged to help tenants who needed it. A number of those companies had detailed policies already in place to assist tenants whose income had been diminished by the health crisis, but far too many had not and have not yet communicated anything to reassure anxious tenants who in the ordinary course have rent payments due on April the 1st. We have enough anxiety in this city among people who are concerned. They're afraid for reasons related to health and their financial security and their future. We just don't need them to be anxious about other things when these companies, if indeed they do, have the intention to help them, which I'm sure most of these companies actually will. And while the city has no power to direct landlords, I strongly urge all property owners, big and smaller, to find ways to help their tenants who need help, find ways to help them, of course, stay in their homes during these unprecedented times, but also to relieve some of that anxiety that people are feeling about a looming date of April the 1st. I also expect landlords to proactively communicate with their tenants with respect to the policies they either have in place or will have in place as a result of this invitation to do so, and make sure that that information is made available to tenants directly affected by COVID-19. We deferred the payment of utility bills and tax bills for 60 days to help everyone, but I would be extremely disappointed as mayor if that flexibility was not passed on to residential and small business tenants who've seen dramatic and sudden changes in their financial situation. And as a matter of fairness, I will also say to all residents, if you can pay your rent or pay your mortgage, if your circumstances have not changed and you can pay your rent or your mortgage, please do. There are many people right now who, through no fault of their own, find themselves in dire circumstances. They need help. But it doesn't help them, and it doesn't help our city or our economy if people who are still employed or otherwise in a position to make these payments of rent or other kinds of payments just decide not to pay. I also want to address the fact that we have learned from Toronto Community Housing that some tenants are receiving calls from scammers trying to use the COVID-19 emergency to prey on our tenants, and this may well extend to people outside of Toronto Community Housing, but I'm not familiar with that. These scammers are claiming to help the tenants buy their groceries, but in the course of doing so, ask the tenants for their credit card and banking information first. This is despicable behavior, and people should know that it is a scam, and the TCHC is on top of it, but they should in no circumstances give their banking or credit information to people. TCHC will not ask for this kind of information, and people like first responders will not ask for that information either. And if you're in any doubt when you're asked for such things, please call 311 or somebody like that who I think will assure you that it's not properly being asked for. Just before Dr. De Villa and Chief Pegg provide their operational updates, I want to stress again something that is really important. We have to have a sense of hope about this. This is an agonizing period. It seems like a very long period. It may be longer still. In fact, it likely will be. But we will get through it because in the context of a lifetime, it is a relatively short period of time, as difficult as it may be. I remain absolutely confident of the fact that we're going to get through this if we follow the advice that we're being given and if we stand together and support each other, and that includes government supporting people. You know, today, it's hard to remember because it seems like so long ago that these things were scrubbed. Today was supposed to be a happy day in the life of our city, as it is each and every year when the Blue Jays play their home opener. Today was that day. I, for one, can't wait for this to be over and for things like a Blue Jays game or even just a walk over to play on the playground for families in our city are available to people again. Because these are things that are very much appreciated all the time, and I know we're all going to appreciate them more, including me, when this is all over with and we're able to get back to those things. And while I know people are scared right now and they're worried for their health and they're worried for their financial future, I can say this to them. I have such faith in the advice we're receiving from our medical officer of health that I know that the fastest way we're going to get over this is to follow her advice and follow her recommendations and follow what amount in some cases now to instructions that people are being given. Stay home as much as possible. Stay home all the time if you possibly can. Practice as much physical distancing. Stay about the length of a hockey stick apart from everybody else, without exception. Don't gather in large groups. Respect the difficult decision that I announced yesterday, which is not an easy decision to announce, to close the amenities in the parks. As I said yesterday, mayors generally like going around opening these things, not closing them. But this was something that was necessary to do in the interest of fighting this virus, which is the war that we're all engaged in together. And if you do have symptoms, stay away from other people to stop the spread. Now, I just want to mention before I conclude that there was a group of people I met with who were very important to us this morning by telephone, about 18 companies from the kind of supply chain and delivery business. And they raised 3 points with me on which I would like to have your help because I think we can do a lot to help these people serve you. The first thing they said, and you may smile and sort of say, well, it's kind of an odd request, but they said a lot of the people who are making many more deliveries now because you're at home and you're ordering things from them, they said that they have difficulty accessing washrooms. And this is a particular request addressed to the sort of small business, those fast food places that may remain open, service stations. In many cases, they're being refused access to those washrooms. And I understand why, because they're confused people sometimes in terms of all these rules. But if you can see your way clear to help them, the city is going to help in that regard as well. Secondly, they pointed out that when letter carriers and other people like that come to the door, a lot of people, I think maybe because they're happy to see somebody or because they want to be friendly, to thank these people for delivering something to them, they immediately open the door and there stands the delivery person closer than they should be, closer than that length of a hockey stick to you. And they're saying, please, wave at me through the door, smile and say thank you, and I'm sure they'll understand. Please don't open the door, because they've also said there's quite a few instances where Fido comes leaping out the door at people who are just trying to do their jobs in very difficult circumstances. And finally, thirdly, they indicated to me that in many cases in apartment buildings, people are doing what they're not supposed to be doing, quite frankly, but which comes naturally to us as human beings, and that is they're having gatherings in the hallway. And some of the delivery people end up on the 11th floor, and lo and behold, there are 10 people from the 11th floor having a bit of a chin wag, and they're saying that they then are afraid to come near that group of people, and of course that group isn't supposed to be there under these rules. And they have said to me that they may have to cease delivering things if people don't stop doing that. So that's not consistent with Dr. De Villa's advice, and it's not consistent with good practice for this pandemic, and it's also going to stop deliveries potentially if you don't change your behavior. So while this has been a gigantic team effort, and they'd be the first to say so, I want to express my particular gratitude thus far into something that could be, as we say, a marathon as opposed to a sprint, to both Chief Pegg and to Dr. De Villa, who have been the leaders of that team together with our city manager, Chris Murray. I am really proud of the outstanding performance of all of the men and women who serve the public in many different capacities, first responders and many others, but I'm also proud of the people of the City of Toronto who are doing better. I don't want to say we're there yet, because we're not in terms of compliance with the doctor's advice, and you'll hear more of that today. But please, please make the effort to think about what you're doing, to think about those hallway gatherings, to think about opening the door. Every one of these things that we simply do every day has a consequence, and it could be a consequence that's a matter of life or death. And so on that note, I'll turn the microphone over to Dr. De Villa.
Thank you, Mr. Mayor, and good afternoon, everybody. As of 1 o'clock this afternoon, there are 339 confirmed cases of COVID-19 in Toronto, and this is an increase of 31 relative to yesterday. There are 22 cases in hospital, 10 in ICU, and unfortunately, there have been 4 deaths in our city thus far. Approximately 25% of the cases in the city are attributed to community spread, and 13 people have recovered. As I've told you before, the numbers are constantly changing, and I will endeavor to keep you informed as these changes occur. Currently, there are 10 long-term care homes, 1 retirement home, 17 chronic care and/or rehabilitation hospitals, and 3 reactivation care centers in Toronto with at least 1 staff or 1 resident with COVID-19. I have been asked by many what constitutes an outbreak in a long-term care home. In this setting, a COVID-19 outbreak is declared when there are 2 or more cases of infection in the facility. And currently, there are 3 such outbreaks in Toronto facilities. The spread of COVID-19 in the long-term care setting is especially concerning because we know the residents of these settings, residents of long-term care homes, are especially vulnerable. For starters, they tend to be older individuals, and many of the residents of long-term care homes have compromised immune systems or chronic health conditions. But part of our core work in public health is working with long-term care homes throughout our city to ensure that proper measures are in place to prevent the spread of disease. And what this looks like, what this includes, are such things as enhanced cleaning. We work with long-term care homes to ensure that they have these measures in place. Enhanced surveillance and monitoring for illness amongst staff and residents. We ensure that protocols and procedures are in place so that individuals who are ill with COVID-19, confirmed cases, are actually quickly isolated within the long-term care setting. We've also worked with long-term care homes to ensure that there are no visitors that are allowed, and we also work with them to ensure that staff are screened for illness when they come into the facility at the beginning of the day or their shift. We also ensure and work with our long-term care partners to ensure that those who are caring for residents use personal protective equipment appropriately, and that's both for their own protection and for the protection of the residents themselves. We continue, unfortunately, to see COVID-19 cases in our community that have affected our most vulnerable residents. And this is why we have worked hard to increase physical distancing actions. I know that other jurisdictions have needed to use stronger social distancing or physical distancing measures to prevent further virus spread. Some examples that I know of would include in Nova Scotia, where police have the power to fine people up to $1,000 for not practicing social distancing. In Montreal, they've banned group gatherings of 2 or more people, and police there are issuing $1,000 fines for non-compliance. I know that in the city of Vancouver, businesses are fined up to $50,000 if customers are not kept at least 2 meters apart. And individuals in Vancouver can be fined up to $1,000. And finally, I know you've probably heard, like I have, that there have been a number of European cities that have enacted restrictions on leaving the home except for a weekly outing to buy groceries and other essential supplies. These kinds of decisions are difficult to make, and decisions to implement these kinds of measures are certainly based on evidence, as well as many other factors and considerations. Things like increasing COVID-19 cases and deaths, the extent to which the public is following recommendations and requirements for social distancing or physical distancing, and certainly one of the major objectives is to ensure that our healthcare resources are protected and available for when we need them. In Canada, community means a lot to us, and we are very, very fortunate to enjoy many civil liberties and freedoms. We look out for and we take care of people in our community, and often we put the needs of others in front of our own. In my mind, this is the core. This is what it means to be a Torontonian, and this is what it means to be a Canadian. And it is precisely for this reason why we have to implement social or physical distancing measures to protect our community at this critical point in time. If people do not follow these protective measures, then stronger ones affecting our civil liberties will be put in place to protect our city. Everyone in our city has a critical role in the direction that we go from here. I want to thank everybody who is protecting our city by staying home and practicing physical distancing. This truly is the most effective way to prevent the virus from spreading. Your families, your loved ones, your friends, and your neighbors are depending on you to do the right thing. I ask you now to please continue the very responsible action of staying home. Please stay home, stay safe, and take care of each other. With that, I'll now turn the microphone over to Chief Pegg.
Thank you, Dr. De Villa, and good afternoon. Late yesterday afternoon, Public Health Ontario provided information and recommendations with respect to the use of personal protective equipment by first responders in response to COVID-19. I am confident that Public Health Ontario is committed to ensuring that our first responders continue to have the personal protective equipment required in order for them to continue to deliver safe and effective emergency pre-hospital care. As recommended, our first responders in Toronto will continue to complete patient care risk assessments for each and every emergency medical incident they respond to, as we always have in the past. We fully support each of our first responders in completing their patient care risk assessments and in selecting and using the levels of personal protective equipment deemed necessary based on the situation at hand. Further, we both understand and respect that the assessment of risk by pre-hospital emergency care providers must also continue to consider other potential communicable diseases, including, but not necessarily limited to, COVID-19. I want to assure both our city staff and the public that we remain fully committed to delivering effective emergency services and ensuring that our first responders have the tools and equipment that they need to deliver safe and effective emergency service. At present, our personal protective equipment inventory for emergency services remains stable, and our first responders continue to be provided with the PPE required to perform their essential work. We fully understand that there are global PPE supply chain challenges as a result of COVID-19. To that end, the City of Toronto is working in direct collaboration with our colleagues at the Province of Ontario and with the Government of Canada to ensure that we continue to receive the personal protective equipment required to sustain our delivery of essential and critical services over the duration of the COVID-19 pandemic. The City overall continues to deliver the range of essential and critical services the public requires, including solid waste collection, safe drinking water and wastewater treatment, maintaining infrastructure, and delivering critical services to our most vulnerable. I want to especially thank the employees at Toronto Employment and Social Services for their hard work and dedication in supporting and serving their clients who rely on them each day. Finally, yesterday, the City announced the closure of parks amenities to further strengthen the message and the action required of the need to limit physical distancing. We need everyone's cooperation if we are to beat COVID-19 and keep our city healthy. Enforcement of this and the other provincial orders around the closure of non-essential businesses is prioritized by our Emergency Operations Centre. If the public has a concern that non-compliance is occurring with respect to these closures, we ask you to call not 911, we ask you to call 311. Do not call 911 unless there is an emergency that requires a response by police, fire, or paramedics. As of 11 a.m. today, Municipal Licensing and Standards has responded to 70 complaints and issued 7 notices for failure to comply with the provincial order to close non-essential businesses. Through our audit, we have issued an additional 6 notices and have re-inspected 8 locations that have now complied with the orders. We've also received 30 complaints related to social distancing in city parks. Since Tuesday, Toronto Public Health attended 73 bars and restaurants that were identified as non-compliant last week. 38 of these are now closed, and 5 warning letters were issued for premises that were non-compliant with the prohibition on dine-in operations. Audits performed by Toronto Public Health indicate a 99% compliance rate. I would like to thank all those who are complying with the social distancing and non-essential business closures. As always, there is a wealth of COVID-19 information on the city's website. Please make toronto.ca/COVID-19 your first source for credible and up-to-date information. Thank you.
Thank you, Chief. First question, Mark McAllister from City News.
Chief Pegg, just to follow up on the first point that you made about the directive from the province with regard to N95 masks and other PPE equipment, how concerned are you that your first responders are now at risk?
Mark, there are robust and have been for a long time. Every time our first responders respond to any type of pre-hospital emergency care incident, the first thing that happens is a patient care risk assessment. So I can tell you from lived experience, the first thing that's happening is an assessment of the situation, an assessment of the conditions that that particular patient may present with, and then a series of decisions are made with respect, A, to the care that's needed, and B, to the level of personal protective equipment that's required on the part of, whether it's a firefighter, paramedic, whatever the case may be. So I have absolute confidence in the ability of our first responders to make those decisions effectively. And like I said, we are providing the PPE that they require. They have the knowledge, the training, the experience, and the equipment to not only to deliver exceptional pre-hospital care, but to do it in a safe, consistent, and effective manner.
And just to follow up to Dr. De Villa, we've talked about this for a number of days now, and it started last week when it comes to our shelter system and the homeless people in our city. There is still evidence that the beds in the respite centers and the shelters that have been set up are still within arm's reach of each other. Why is that the case when this problem was supposed to be solved last week?
So I can tell you that we have worked at Toronto Public Health alongside our colleagues at Shelter Support and Housing Administration to try to create those circumstances that allow and that make the most safe environment for residents of the shelter system. I completely appreciate that there may be some ways to go yet and improvements that have been made, but I think it's important to note that there has been a strong and collaborative relationship between those of us at Toronto Public Health and at Shelter Support and Housing Administration and the specific shelter providers to try to create that safe environment. There are a number of protocols in place. We know that distancing is important, and we heard from Marianne Bedard, the General Manager of the Shelter Support and Housing Administration, that a number of new facilities have come online in order to create that distancing in the shelter system. I'm certainly interested in hearing of issues that require further improvement, and I have no doubt that my colleagues in the shelter system, the shelter providers, are going to continue to work towards better conditions and to seek to create those environments that allow for the safety or that create safe environments for those who are using those shelter facilities.
Thank you.
Thank you. We'll go online now to Jeff Gray from the Globe and Mail. Jeff, go ahead.
Hi, everybody. I just want to follow up on that shelter issue. There are certainly, talk to people who run a shelter, people who've been in and seen them, that this issue of whether there are 6 feet between people in even the existing shelter seems to be an open question. How confident are we that we're doing all that we can to protect the homeless people, where this could really run through the shelter system quickly?
So I would say that, as I had in the previous question, there is a great deal of work that has happened between Toronto Public Health and the Shelter Support and Housing Administration colleagues that we have. I know that the General Manager, Marianne Bedard, has spoken to the media on several occasions and has given a very comprehensive list of the many measures that have been taken to date, including opening a variety of new facilities in order to create for greater spacing between shelter clients. I am concerned. We are certainly concerned. We know that people in our shelter system are vulnerable. Many of them have chronic and existing health conditions that make them vulnerable to COVID-19 infection. And certainly we want to do our very, very best to create the circumstances that allow for them to experience the best health and to live in an environment, to be in an environment that actually protects their health and safety. So again, I would encourage people to, inform us of concerns that they might have, and rest assured that we are working as quickly as possible to create the appropriate conditions, to create safe conditions for all those in the shelter system, whether we're talking about clients who are in need of the shelter or those who provide the services.
Just to follow up to the mayor, are you concerned that I know lots of work is being done. I know there are hotel rooms being looked at and all sorts of other solutions, but can the situation in the shelters actually be fixed, be dealt with in time before we see some really terrible things happen?
Well, as the medical officer of health said a moment ago, and I rely very much on her advice in these matters, it is a place where, because you have crowds of people by definition that are in the same building, there has to be extra precautions taken. But if you said to me, am I confident that we can, as I think has been the case through the excellent work of Marianne Bedard in close cooperation with the Medical Officer of Health and others, including those in the nonprofit sector, can we address those things as they come up and make sure that the protocols and the standards are being met? Yes, we can, and I believe we have. And I think as some of these examples have come to our attention through various means, I have every confidence that the officials are addressing them, and I think the amount of work they've done, and I will take a tip of the hat to Councillor Joe Cressy as well, the Chair of the Board of Health, because he's been a relentless advocate on making sure every day, every single day on our call we have at 7 o'clock in the morning, this is a matter that is discussed. And so as these things come to our attention, I think we've responded very well. The number of new sites, I think there are at least 9 that have been set up during the time since this became a very acute crisis and before. Arrangements that are being made, as you alluded to have other facilities available to us in the event of an increase in the number of people who need special care and attention. Those things have been done, and they will be done, and there is no question about resources or anything like that. Sometimes there's a challenge for us in making sure our medically trained people are available to look after those who require medical help, but I will just tell you that I think that we're on top of this, we're very diligent on it, and that anybody who has any instances that should be brought to our attention we may not know about, then please do, because I can tell you the staff will react to that immediately and fix whatever is wrong, and I think that's exactly what they have been doing.
Okay, Matt Bingley from Global News.
Just want to follow up on that same vein. We've seen pictures of these new sites that have opened up. The beds aren't 6 feet apart. Other advocates are pointing out that the other shelters still are using bunk beds. The mayor just said a second ago that no expense would be factored into this, but I'm just wondering, some advocates are saying that we should be leaning more on the hotel industry, so I'm just wondering at what point would you look at all those vacant rooms and suggest that perhaps these individuals should be better suited staying in there to be spaced out more?
Wait, you direct that to me?
Sure.
I will say to you, we already are. I mean, some of the 9 sites that I referred to and some of the other arrangements that I made allusion to that are in the process of being put in place are doing precisely that, which is common sense, using empty hotels for purposes of making sure that we can not only comply with our own protocols, but also address some of the health-related issues that require people to be in different places from one another. And so I can just say that I'm confident that, I think when you see some of these photographs, I'm very hopeful and very optimistic and quite confident that they're photographs that represented something that happened yesterday, and that doesn't mean it was a good thing then, but it means we've got on top of it and fixed it today. And I think our people are very much on top of this, and they will continue to be, and we have said whatever it is they need to make sure we properly care for some of these most vulnerable people, they will have it. There's been no questions asked about that, and sometimes there's a challenge for us, more than slight, finding exactly the right place and the right kind of accommodation and the professional staff to do it, but I think they've moved remarkably fast to get a lot done in a relatively short period of time.
Mayor, it is nice to see you here, but we've been telling people time and again, based on the advice of Dr. De Villa, to stay home. We've seen in the past 13 days or so that you've been in isolation, that you are capable of working from home. I'm just wondering, when there is that messaging for trying to encourage people to do this, why you felt it was important to come here in person.
I stayed home until I think about 1:30 today. I will return home after this briefing, but I think that the best way that we can, both for your convenience, quite frankly, and to have a coherent message, including some of the things that perhaps I can say about landlords that don't fall within the purview of Dr. De Villa or Chief Pegg, that I should participate most of the time, perhaps not all, in these briefings, but I will be spending most of my time at home, working from home, following the advice that we've received and that I have given to people. But I think most people out there will understand that it is appropriate for me to come to City Hall as part of doing my job properly, and it may well be that on a very limited basis I will go other places to make sure that I can watch what some of our excellent team of people are doing to provide services for people. But I'll be taking every care and every precaution when I do that, when I'm in this building and elsewhere, to make sure that I follow the rules. But I think I am following the rules by and large that say that whenever possible I work from home, and that's exactly what I'll be doing.
Okay, online, Brian from the Toronto Sun. Brian, go ahead.
Oh, I didn't have a question.
Okay, Brian, no problem.
I'm listening. Thank you.
Okay, Francine Copen from the Toronto Star. Francine, are you there?
Yes, yes, I'm here.
Go ahead.
I'm interested in more detail about the hotel angle. Are the hotels currently preparing to receive people, or have they already received people? And if they have, is it people who are experiencing homelessness, or is it people who are being moved from, for example, long-term care beds in hospital, and how many hotels are participating?
Well, the fact is that as part of our caring for people who are homeless and vulnerable, and Dr. De Villa may wish to add to this, but as part of our program on an ongoing basis before COVID-19 hit us, we have used hospitals, at least hotels rather, as part of our process for sheltering, for example, refugee families. And so the use of hotels is nothing new. We have, as part of opening some of the new facilities we required for a series of different reasons related to COVID-19, used hotels. We're not going to indicate sort of where they are or what they are, but we have made arrangements and will continue to make further arrangements as needed to provide that accommodation. So from the sort of logistical standpoint, where hotels make sense, where they can and need to be used, and where we can get the medical help necessary to turn a hotel into a place that people can be provided with proper care, that's what we'll do if that's the best answer. And maybe on that note, I'll turn it over to Dr. De Villa.
Yeah, so in further follow-up to that, I know that we have used hotels, for example, to help isolate individuals who have developed symptoms that may be COVID-19. They have testing and they need a place to stay in isolation from others so as not to promote the spread. So I can certainly assure you that hotels are being used for those purposes. I know that there are other facilities that are being explored, and my understanding is that conversations are continuing between those at Shelter Support and Housing Administration and various hotel facilities around the city in order to address the needs that exist right now in our shelter population.
Okay, thank you. To Haley Cooper from News Talk 1010. Haley?
Hi, can you hear me?
Yes, we can.
Perfect. My question's for Mayor Tory, please. So the cherry blossoms in Hyde Park are expected to bloom earlier this year because of the rain and warmer temperatures, and we always see such large groups converge at Hyde Park to see these cherry blossoms. So we just want to know, is the city thinking of putting extra security in place to break up such gatherings this year?
Well, I don't want to quite put it the way you did, but I will say this. We are on top of the cherry blossom predictor, which has existed for many years and kind of talks about, based on weather and other circumstances, when the cherry blossoms are likely to bloom. We have, as you know, taken steps to reduce access to amenities inside parks, but we've had a very preliminary discussion, and we will base it, of course, on the advice of the Medical Officer of Health. But if people understand how the crowd scene arises out there each year for the cherry blossoms, I think they will be able to read the tea leaves themselves and saying we're going to have to do something about that in anticipation of that. And if that involves, and I'm just speaking for myself, but I will take whatever action is recommended to me by the Medical Officer of Health. But I will say right now that if we have to make arrangements to create the cherry blossom channel so that people can see it on television but not go there, I would not hesitate to accept a recommendation to close the park for that purpose, to close access to vehicles to that park, and to unfortunately say for this year, when we're in dire straits with a health crisis, that we can't have people going in large crowds to see the cherry blossoms. So we'll see how it unfolds, but I think it's a crowd scene. I've been to it, and it's a pleasant crowd scene when we're not in a war on a virus. We are in a war on a virus, so I think circumstances are very different, but we'll see.
I like that idea, the cherry blossom channel. And regarding Easter coming up, families are going to want to get together. So what is this city planning in terms of its messaging? You've already been pretty aggressive with the messaging on social distancing. Can we see something even more aggressive?
So I'll take that question. As I mentioned in my remarks, we really do have to practice social distancing, and I've been urging the residents of Toronto to continue to practice social distancing. However, if the protective measures are not being followed, then we will have to consider stronger measures. But I would suggest to you, as I've said before, that getting together for dinner, even or lunch or brunch, whether or not it's in respect of a religious or other holiday, is not social distancing. I think we're going to have to find more creative ways to connect with each other for the important occasions, virtually, using the various tools that are available to us thanks to technology.
Okay, Scott Lightfoot from CTV. Scott?
Question for Dr. De Villa. You issued a rather stern warning this afternoon, perhaps even a gentle threat about what might need to be done if people don't adhere to the distancing requirements. This is not new. Public health's been asking people to do this for days, maybe a week now. Many people are, but you're still seeing people playing soccer, walking groups, crowding in streetcars. You mentioned other cities have also already taken these steps. Why hasn't Toronto taken further steps already? And what are the steps you would see the city taking if need be?
So I think when we take these kinds of steps, it has to be done within the context of the city itself. So I can't speak for the circumstances, in Montreal or Vancouver or the European cities that have taken more assertive action in respect of supporting social distancing or physical distancing. We're certainly monitoring, as we have been for many, many weeks now, the circumstances here in Toronto, observing what our COVID-19 case counts look like, what we believe is happening in respect of virus spread in our community, observing the behaviors and how well people are adhering to the recommendations, or for that matter, how they may not be adhering to those recommendations. And I am prepared to take stronger measures on an as-needed basis. But it does have to be very much context dependent. And I would suggest to you that it works better. These kinds of public health measures, particularly the very strong ones, are the kinds of things that you want to do in concert with all levels of government. It has to be done in a quick fashion, but with care, and in a coordinated and collaborative fashion, because we know that there are consequences to all of these decisions that are taken that go beyond virus control.
You mentioned what other cities are doing. You said you couldn't really comment on what they're doing, but what have you taken from what you've heard that you think would be applicable here in Toronto in terms of the level of these controls you would want to put in place?
Oh, we are looking at all the measures that every jurisdiction around the world has deployed in respect of virus control. I think that's what's part of a responsible public health practice, particularly looking at those jurisdictions who are further ahead in their COVID-19 outbreak experience relative to us. So I assure you, we are looking at every practice that every jurisdiction has done, but we have to consider whether those practices, those measures make sense for us here in Toronto, right? Each context is unique, and different measures that work in other jurisdictions, other cities, other countries may not work well here. So we have to balance out all the different considerations, and certainly context matters. It's relevant.
Okay, Mark Douglas from 680 News. Mark, go ahead, please.
Hi, thanks, Brad. Mayor Tory, nice to see you back in person. The TTC with the lost revenue, you mentioned earlier this week, $20 million a week. It could be $18 to $20 million per week in lost revenue. Do you believe the TTC, to balance the books when COVID-19 is in the history books, is the TTC going to require a bailout?
Well, I don't think you look at things that way. First of all, we don't look at it that way in the context of what we do about the TTC by itself. If we did, there'd be people, in fact, I was speaking to the media and a question came to me, why do we have all these vehicles going around when they're only kind of a quarter full? And I said, well, there's other considerations you take into account besides money, including, very importantly, the fact we need to maintain a certain level of service to get all of our healthcare workers, public health workers, first responders, grocery store people, and so forth to work. I had people telling me on the phone from that supply chain group that I made reference to earlier this morning how important it was for those people that people out there are relying on to deliver them things, how important it was for them to get to work on the TTC. So it's not just about money, but then it's also very much about health, because in the end we could cut back tomorrow morning on the number of vehicles that are on the road and have them have more people on them and save a lot of that $20 million we're losing. But the fact is that would then put more people in close proximity to one another, which the medical officer of health has told us is not advisable. And so we will take these things one at a time. I've had 2, now 3 detailed briefings on the city's finances, trying to look out and see what the full consequences are of all of this that's going on, and they're not inconsiderable. I am talking to the other governments about the state of city finances. In fact, we're having a meeting by telephone tonight with the Deputy Prime Minister of the Big City Mayors of Canada to talk about this. But you're not going to take one decision in isolation from another and say that the TTC needs something or somebody else needs something. You've got to look at the whole picture and all of the responsibilities we have to provide services to people of all kinds, and where we get the money from and how we make sure we can continue to provide those services in as cost-effective a way as possible. So that's the challenge that's in front of us, but the TTC will continue until further notice to do what it is doing, and I think they're doing it very well, and I thank the management and the operators for all of what they're doing to make sure people can get to where they need to be.
And to follow up, Mayor, the TTC is currently running at 80% service level. How long do you think that could continue? And just to add to that, after this news conference began, a press release came out from the advocacy group TTC Riders calling for free fares on the TTC during COVID-19. So two-part follow-up then. How long can 80% service levels continue? Would it have to fall, or could we possibly raise it? And could we have free fares?
I think because of the health-related reason for having full service so that vehicles are not more crowded, that the answer would be that we would try to maintain the service levels and the service available service being delivered for as long as possible. And I can't be more precise than that, because I think given that there's a health reason behind it besides any other reason there might be, that it is something we'll want to continue with as long as possible. Now, I have pointed out, and your two questions are very much related, because in other places where they have given free transit to people, they have also reduced service, which we have not. We've made very, very tiny adjustments to service on some of the express bus routes and things like that. And I've explained why. We've done that principally for health-related reasons and for reasons of allowing people to get, especially to medically related things. We hear a report each morning on what the purpose is of the use of transit by people, because obviously that's a consideration as to whether people are following the social distancing recommendations made to them. And the single biggest reason people are on the TTC is related to medicine and healthcare and health-related concerns, including people going to work in the healthcare system. And so that is something I'm not anxious to see us tamper with for financial reasons, but we're going to have to do a lot of planning and a lot of work, which we're already underway with, to make sure that we can do all the things we have to do and at the same time keep the city's finances in good order. And I should say in that regard that while we have had a presentation about the city's finances, and while there are no questions but that there are challenges looming for us, because the city has been well managed, because we have solid reserves, because we've been careful, and because we will continue to be careful while still providing services for people, we will get through this financially. But that is the objective, and that's what we're working on right now.
Okay, last question goes to Lorenda Redicott from the CBC. Lorenda?
Hi there. This is a question for Dr. De Villa about long-term care homes. We see those numbers. Do you have a sense of how much that has changed from yesterday, and how concerning are these numbers, or are they around what you expected?
Well, outbreaks in the context, and COVID-19 in the context of long-term care homes is always concerning. We know that COVID-19 in particular as a virus hits hard on those who are on the older side of the age spectrum, and also hits hard on those who have chronic conditions and or immune compromised or some kind of immune compromise. So I think it's always concerning to see or hear of COVID-19, whether it's a singular case or in fact an outbreak situation in long-term care. I think that given the experiences of other jurisdictions, we're not surprised, and we were actively preparing with the long-term care sector, trying to make sure that they have all they need in respect of infection prevention and control practices in place, and that they're ready to deal with outbreak type situations. So we have worked very, very hard with our long-term care partners to ensure that they're doing all that they should be doing. As I've mentioned, everything from enhanced cleaning, enhanced surveillance and monitoring for illness amongst either staff or residents, isolating cases as soon as they're identified, ensuring regular contact with public health and with families of those who reside in long-term care, limiting visitors, screening staff actively each and every day. These are the kinds of measures that are put into place in order to protect the health of those vulnerable individuals who live in those settings.
And a follow-up, we've heard the concerns about not having widespread testing in terms of the general public, but what about with long-term care homes? Could the actual number of cases be quite a lot higher than what you're seeing?
Well, in fact, the testing criteria now are such that those who live within or work within long-term care would be seen as high priority for testing. So I'm confident that the testing that needs to be done for those within the context of long-term care is being done.
Okay, thank you very much, everybody. That concludes today's briefing.